Добрый день.
Good morning, dear colleagues and guests, friends. Let me declare open the session of the Dissertation Council for the Defense of Thesis by Kubin, Nikita, Dmitrievich for the degree of Doctor of Medical Science, Specialty 14-01-23, Urology, and the subject personalized approach to the treatment of patients with stress, urinary incontinence, or pelvic organ prolapse. According to the order number 5100/1 of the 16th of May 2019 of St. Petersburg University, me, Popov Sergei Valeryevich, Doctor of Medical Sciences, Associate Professor, Department of Hospital Surgery, St. Petersburg University, was appointed Chairman of this Dissertation Council. Let me also introduce my fellow council members. Gvozdev Mikhail Yurievich, Doctor of Medical Sciences, Yevdokimov, Moscow State University of Medicine and Dentistry. Guleev Bahman Gidayatovich, Doctor of Medical Sciences, Mechnikov, Northwest State Medical University. Petrov Sergei Borisovich, Doctor of Medical Sciences, First St. Petersburg State Medical University. Sievert Karl Dietrich, Lippe Clinic, Germany. And in remote interaction at the mode we have Petros Peter Emanuel Papa, Vincent Hospital, University of New South Wales, Australia.
Yeah. Okay.
First, let me emphasize that according to the federal law of the 23rd of August 1996, number 127, on science and the state scientific and technical policy, St. Petersburg University has the right to award academic degrees independently. The corresponding order on the procedure for awarding academic degrees at St. Petersburg University, on the basis of which we are holding this session of the Council, was issued on 1st of September 2016. Order number 6821/1, hereinafter the order. In accordance with this order, the session of the Dissertation Council is duly constituted if at least 2/3 of the approved members of the board are participating, but not less than 4 persons. Our council consists of 7 members. 6 members are present, including 1 member of the council in remote interactive mode. Thus, there is a quorum. Let me set forth the procedure of today's session with a total duration of no more than 3 hours. First, the Chairman's brief report on the main content of the documents submitted by the candidate and their compliance with the applicable requirements, and answers to possible questions. A brief presentation by the applicant outlining the key points of his research, 15 minutes. Questions to the applicant strictly on his report, no more than 2 minutes per question, and answers of the applicant, speeches of all members of the Dissertation Council with their reviews, with a statement of their positions, questions and suggestions to the applicant, no more than 10 minutes for each speaker. Speech of the Chairman with his feedback, answers of the applicant to questions and remarks of the members of the Dissertation Council, no more than 15 minutes. Open discussion, speeches of the attendees with a summary of their positions and specific questions and suggestions to the dissertation. Strictly on the topic of the study, not more than 5 minutes per person. To do that, all the speakers are kindly requested to put their names on the registration sheet and introduce themselves in full before speaking. Final answers of the applicant to questions asked, no more than 5 minutes. Speech of the academic supervisor, no more than 3 minutes. A 5-minute discussion before the open voting on awarding or not awarding the academic degree to the applicant. Open individual voting and counting the votes and recording results in the minutes of the meeting. A decision on awarding or not awarding the academic degree to the applicant. Closing remarks of the applicant, no more than 2 minutes. Before starting the official procedure, let me remind you to switch off your mobile phones. Thank you for your understanding. Let me also inform you that our meeting shall be recorded and broadcast online at the university website. The speeches shall be simultaneously translated from Russian into English and from English into Russian. So let's begin with the first item, Chairman's summary report. Kubin, Nikita, Dmitrievich, thesis for the degree of Doctor of Medical Sciences and Specialty 140123 Urology on the theme Personalized Approach to the Treatment of Patients with Stress, Urinary Incontinence and Pelvic Organ Prolapse, was adopted for the defense by the order of the Academic Secretary of St. Petersburg University on the 16th of May 2019, order number 1599/1. The Dissertation Council was appointed on the 16th of May 2019, order number 5011/1, and I have already introduced its members to you, dear colleagues and guests. The applicant submitted the following documents to the Academic Secretary of St. Petersburg University: an application to the Rector of St. Petersburg University, Professor Kropotchev, for acceptance of the thesis, submitted on the 20th of March, a review by the academic advisor, Dmitrievich, senior urologist of Pirogov Clinic of Advanced Medical Technology, St. Petersburg University, head of the Northwestern Center of Urology, a list of 21 publications which set out the main scientific results of the thesis, including 14 articles in peer-reviewed scientific journals from the list approved by the Ministry of Education of the Russian Federation, 3 articles in journals indexed in the databases Web of Science and Scopus. A diploma of Candidate of Sciences, DKN 2070-23, certified that by the decision of the Dissertation Council of the Kirov Military Medical Academy of the 19th of December 2013, number 15, Kubin, Nikita, Dmitrievich was awarded the degree of Candidate of Medical Sciences. The thesis in Russian and English on paper, on the rise of manuscript, and in the electronic form. The thesis is designed in accordance with the requirements of GAST R7.0, printed on a photocopier with the indication of the output data. It should be noted that all the documents listed above comply with Clause 12, Section 3, Thesis, Presentation and Defense of the procedure for awarding the academic degrees at St. Petersburg University. Annex 1 to the order. If no one has any questions at this point, let's give the floor to the applicant. No one has any questions at this point. Mr. Kubin, welcome. Dear Chairman, members of the Dissertation Council, colleagues, friends and guests. Stress, urinary incontinence and pelvic organ prolapse affect up to half of women in the population. This disease, although is not life-threatening, dramatically reduces quality of life of patients and ultimately lead to their social disadaptation. It's no coincidence that only in the U.S. More than 200,000 surgeries are performed annually. And taking note that by the middle of the century, more than 2/3 growth of mobility is forecast, it's possible to speak about a latent epidemic of these pathologies. Unfortunately, there's currently no single approach to the treatment of POP patients. Moreover, the methods used are not effective enough and have a number of drawbacks. Although there is a recognized standard in the treatment of stress incontinence, subuteral sling, its efficacy varies widely from 50 to 90%, and up to 20% of patients undergoing surgery face some form of obstructive urination. The aim of presented work was to increase efficiency and safety of treatment of patients with pelvic prolapse and stress urinary incontinence through the introduction of new methods of surgical correction, development of clinical protocols for patient management. To achieve this, the following objectives were set: to develop a method of urine-sparing hybrid surgical technique of pelvic organ prolapse treatment and evaluate clinical efficacy and safety; to develop a method of hybrid surgical correction for post-hysterectomy prolapse; to develop a method of mid-uteral sling implantation with the possibility of early mobilization; to develop a clinical protocol for managing patients with pelvic organ prolapse and stress urinary incontinence when using the method described above. The study included 1,224 patients, 474 of whom had anterior apical, 116 posterior apical, and 83 post-hysterectomy prolapse, and 573 patients were operated on for stress urinary incontinence. All patients underwent treatment at the St. Petersburg State University Clinic of Advanced Medical Technologies between 2015 to 2017. The monitoring period was 12 months. Before and after surgery, the examination included anamnesis and validated questionnaires. Pelvic prolapse was staged using the POPQ system, and in the case of urinary incontinence, the stress test was carried out not only while lying down but also while standing, which is particularly important as some patients only lost urine in this position. At the beginning of the 20th century, the most popular contemporary method of pelvic floor reconstruction was proposed, colporthy, this of which is to suture the outer surface of the damaged fascia. However, the unreliability of the sutures and the frequent combination with the lower and apical compartments led to the fact that their effectiveness rarely exceeds 50%. Already in the middle of the last century, the importance of the apical compartment was understood and fixation was developed, which is still a method of choice for many surgeons. Unfortunately, due to vaginal axis displacement, is often accompanied by prolapse in the anterior compartment and dyspareunia. In the beginning of 2030, panacea mesh implants appeared to be found, but the incorrect use of the latter led to a number of complications, which practically put the end to this trend. And surgeons were faced with the choice to use traditional approaches, which in the absence of a reliable apical fixation are doomed to failure, or a new standard of sacrocolpoplexy, which is demanding not only to the technical equipment of the operating room and the level of the surgeon, but also to the somatic status of the patient, and at the same time as a number of specific complications. For the sake of consistency, it's necessary to say that the problem of prosthetic surgery lies more in the paramedical plane. Initially, media and enterprise lawyers created a field for making money and unfair competition between companies. Then came a famous prospect study which seemed to completely disprove all the benefits of prosthetic surgery. However, later on it was completely debunked in a detailed review. And this year, one of the mesh repair apologists was arrested for organizing a fraudulent prosthetic explanatory scheme in healthy women. Despite this, the FDA, the American analog of Roszdravnadzor, had still banned all vaginal implants. At the same time, more than 10,000 experts signed a petition to revoke this decision. And this is not by chance, as more than 80% of all pelvic floor reconstructions are traditionally performed transvaginally. Today, it's absolutely clear that it is impossible to do without synthetic materials. It's reasonable to make the most of the native tissues with a pelvic floor support system. Taking all this into account, a unique hybrid pelvic floor reconstruction technology was proposed, which includes bilateral fixation with an apical sling. This not only ensures reliable fixation, but also the physiological position of the uterus. Subfascial caloprophy, in which the inner surface of the fascia is sutured, which results in high reliability, prevents stitching of the underlying organs, and completely isolates the implant from the external environment. And by combining the apical section and suture, the efficiency on the pelvic fascia reconstruction is increased. At the same time, a Russian apical sling and guide for its installation were produced by Lintox, and it happened back in 2013, before the wide implementation of the once popular uphold system. The technique was as follows. After subfacial access, the apical sling was bilaterally conducted through the ligaments and attached to the cervix of the uterus, followed by subfacial caloprophy, which was joined with the suture. When pulled by the ends of the implant, the apical section also pulled up the endopelvical fascia. The 590 patients with anterior apical and posterior apical peroneus were operated on using such technique. The duration of surgery did not exceed half an hour, and the blood loss was only 30 milliliters. The result of observation showed a significant improvement in all the leading points of the POPQ system, and in case of anterior apical of the uroflowmetry indicators. Recurrences most often occurred in the anterior compartment, but only in 5 patients they exceeded stage 3. At the same time, the total efficiency for the anterior and posterior sections was 89% and 96% respectively. Also, the statistically significant improvement in the quality of life of patients was noted. During the study, the most formidable complications were bleeding and damage of the internal organs. However, they did not exceed 1%. The most frequent complication was a temporary functional bladder atony. It's important that due to the original colporthy technique, the number of extrusions did not exceed 1%. The work not only analyzed in detail various complications, but also described methods of their control and prevention. Although the uterus is not a direct cause of prolapse, hysterectomy continues to be the most popular method of prolapse control. At the same time, the treatment of post-hysterectomy prolapse causes the greatest difficulty for the surgeon. After all, in the absence of cervix, there's simply no point for fixation. There's no coincidence. The majority of relapses occur at the point of fixation. To solve this problem, we developed a unique method of near cervix formation from surrounding tissues, in which the apical sling was attached to the dome of the vagina indirectly by special ligatures passed through the conglomerate of gathered tissues. Thus, the implant was securely separated from the external environment, and the conglomerate of tissues allowed to securely fix to the apical part. The results of observation of 83 patients operated by described the method showed its high anatomical efficiency. There has also been a significant improvement in the quality of life of operated women. Unfortunately, mucous membrane atrophy has led to a sufficiently high level of suture extrusion, especially at the stage of testing the technique. However, the methods of prevention of this complication developed in later years have significantly reduced its frequency. Thus, the surgical reconstruction of the pelvic floor due to the original approach to the repair of the first second levels of support and the minimal use of synthetic materials allows to achieve higher efficiency and safety in the treatment of patients with POP. The technology of pelvic floor reconstruction was described in domestic and foreign periodicals, presented at various conferences, and most importantly, its simplicity, efficiency, and safety made it popular in clinics across Russia and the CIS. The main problem of modern suburethral slinging is the degree of tension, which determines the result of the operation. However, there is no standards for its measurement. The excessive tension leads not only to obstruction, but also to the development of a hyperactive bladder. To combat this complication, concepts have been reached. The experts have introduced the concept of early mobilization, implying uncontrolled lowering of the prosthesis after removal of the sutures, which doesn't seem to be very reasonable, as it is not clear how much it's necessary to weaken it and what do we do if we try too hard. With this in mind, we have developed a new concept for the mid-uteral tape. The implantation remained the same, but it's now possible to select the optimal prosthetic tension in a controlled and personalized way. To achieve this, 2 adjustment threads were attached to the standard sling in the central part. After implantation, the ends of the sling were not cut off, but served to increase the tension of the sling by adjusting threads. On the contrary, we used to loosen it. Specialization was achieved by fine-tuning tension by comparing uroflowmetry before and after surgery stress testing and measuring the residual urine volume. And this is a fundamentally new approach. Now you're not afraid to see obstruction or positive cough test because you can control it. As it is known that up to 20% of patients do not have residual urine but suffer from obstructive urination. Agree that these patients with no residual urine have different quality of urination. Almost 600 patients were operated according to the proposed method, and its use did not lengthen or complicate the surgical intervention. The analysis of surgeries performed by surgeons of our department showed that 40% of patients required adjustment of sling tension. Interestingly, a significant increase in the experience of such interventions allowed us to reduce the level of mobilization by a third, but it's still quite high, and today does not depend on the experience of the surgeon. The objective and subjective efficiency of the method was 95% and 96% respectively. Thus, the technique of installing a sling with the possibility of early mobilization does not differ from the classical one, but allows the surgeon to achieve the optimal sling tension and avoid such serious complications as obstructive urination and urinary retention. Ironically, the methodology we have proposed has been described by the foreign press immediately following the consensus of experts in the field of post-operative obstruction, and this is no cases because it's indeed a problem. Into the urologists awarded the tunable sling technique with the second prize. All this once again confirms the correctness and timeliness of the proposed method. At the final stage, based on the experience we gained, clinical protocols for the management of patients with pelvic prolapse and urinary incontinence were developed. This algorithm allowed to unify the work with patients at all stages of their treatment, which made it possible to increase the efficiency and safety of the proposed methods and easily implement them in the practice of our own and other hospitals. The results of the study became the basis for further development of technologies. Thus, at first, the technique of unilateral surgical reconstruction was created. And now the three-level hybrid reconstruction is already being actively implemented. Recently, a randomized trial has been launched to compare the standard regulators links. And over the period of 7 years, our technologies have gone a long way from 2 large implants, to which we have adjusted patients, to the most personalized 3-level hybrid reconstruction with the precision use of synthetic materials. Thank you for your attention. Questions to the applicant strictly related to his presentation of the key findings. No more than 2 minutes for each question. Let's hear the reviews, including external ones. We don't have any external reviews. So let's start with Professor Kasyan. The review was positive. The opinion was positive. The thesis tends to specialized field, and in conclusion, let me read the thesis of Nikita Kubin to this subject: personalized approach to treating patient with stress incontinence and POP, following the order on the degree of avoiding academic duration at Petersburg University, complies with the requirements, and the applicant deserves to be awarded the degree of Doctor of Medical Sciences, specialty 140123, Urology. Class has not been violated by the applicant, Professor Kasyan. Further, let's hear reviews of the members of the Dissertation Council. Let's start, because we are in St. Petersburg. Let's give the floor to a professor who kindly agreed to take part in this meeting. We'll give the floor to Professor Petros, who's in Australia in remote mode, while connection is good. Professor Petros, please read your review.
I don't have it with me at the moment, but
сейчас у меня нет, к сожалению, с собой текста.
But I can summarize. Look, this is a very good thesis. It has systematically proven that the problem with prolapse and symptoms is damaged ligaments. And so I have 2 comments about that. As regards the prolapse, the posterior sling, which recreates the uterosacral ligaments, is a very, very important part of this thesis. And because, the second part is I am, as you know, the developer of the midurethral sling, and I think that as you know, the problem with retention after a sling is because of the Poiseuille's law, which shows that the resistance to flow is exponential and inversely proportional to the fourth power of the radius. So it is very difficult to get the exact too tight or too loose with the sling. And I think this innovation is wonderful, where post-operatively you can make it looser or tighter, because it's impossible, if you consider Poiseuille's law, to get it all right in one go. And I think this is a wonderful thesis, and it should be awarded to the candidate. Thank you.
Thank you. Professor Petros.
Yes.
Let's proceed to the next review submitted by Professor Siebert. Let's give the floor to Professor Siebert.
Thank you very much. Possibility to review this thesis. As the candidate pointed out, we face the situation of the FDA internationally, who considered to withdraw all materials used for POP surgery. Knowing this, the candidate pointed out the momentary techniques. And as Professor Petros just mentioned, it is outstanding what has been done over the time of this investigation. Over 1,200 patients have been undergone the surgery and been analyzed for POP or SUI. The surgical time is also impressive because it is one of the problems. If there is a long-term surgery, it causes complications. With a 30-minute surgery procedure, it avoids complications. And as mentioned before, it is needed to adjust the situation after the procedure. The outstanding situation has been published in over 17 articles by now, internationally with poster presentations, and in addition, accompanied with 3 patents. In conclusion, I suggest to accept this thesis for Dr. Kubin, to recognize for his doctoral medical science, specialized 14.1.23 in urology, Article 11. Thank you very much.
Thank you so much, Professor Siebert. Do you have some questions? Прошу прощения.
У меня...
Профессора Зиверта какие-то вопросы?
Well, one question is, because you are reporting about the one-year data, and I think it is important, as we know from the international publications, and I'm sure you have perceived that. What is your long-term situation? Because like one major issue is chronic pelvic pain, and how did you deal with those situations?
Dear Dr. Siebert, in the course of our study, unfortunately, we encountered this complication of chronic pelvic pain. And in case of sling implantation, only 2 patients had this complication. In one case, we had to extract the implant because conservative therapy was ineffective. And in another case, patient felt better after the conservative treatment. And in case of pelvic reconstruction, especially of the apical section, we also had an experience of treating patients with chronic pelvic pain. We had 5 such patients. and only one patient had her implant removed. 4 patients had pain because of neo-abscess syndrome.
So could you explain in 3 or 4 key points why you have such a low complication rate compared to the international publications? What are those differences?
First is post-operative examination of patients. We examined each patient if she had chronic pelvic pain before or any neurological diseases before surgery, because our surgery can make existing problems, existing diseases worse. Secondly, is anatomical advantages of our approach. Because cases of suburethral sling is we always implant it below to the ligament, and in case of the apical sling, we always implant it at least 2 centimeters away from the spine, ischial spine. Спасибо.
Professor Zivert,
Dr. Zivert, are you satisfied with the answers, with the answer of the applicant?
Thank you for you.
Further, let's hear the review of Professor Gvozdev. Good morning, dear colleagues. For me, this is an honor to take part in today's session. It's a very important milestone, which will probably start a new age, new era, and the possibility to do such research. Of course, I have a standard review which complies with the protocol of the meeting, but and of course I'll say what I have to say, but first of all let me say that what I really liked about this thesis, maybe that was only an attempt, but we really need sound clinical protocols. The story of mesh implants happened because we had no clear clinical protocols, and the peculiarities of our national healthcare system, the quotas which we have, and the key point of this thesis is that that you are suggesting clinical protocols of managing such patients. And it's very important that your own approach to managing complications. I have some minor questions. It's interesting for me to know your opinion. The only study you mentioned is uroflowmetry. What's your approach to using a combined urodynamic investigation to assess type of incontinence and the choice of treatment strategy? This is really an important issue. Foreign colleagues had a discussion sometimes about the dynamic examination, which is quite an expensive examination at the moment. I agree with my foreign colleagues that in 90% of cases, incontinence can be evaluated by talking properly to the patient, feeling questionnaires, keeping diaries. You may understand what type of incontinence a patient has. In our hospital, when we first meet a patient, in case of doubt, we have a whole neurological service which deals with such complicated cases. Someone who's using diapers, who's wearing diapers all the time, for example, in that case, patients undergo complex dynamic investigation. In other cases, it is sufficient to questionnaire the patient, and stress incontinence can be assessed through simple examination. And in process of surgery, we use uroflowmetry only, of course. It's part of our routine. And as promised, I have to say that the thesis of Nikita Kubin, a personalized approach to patients with stress incontinence and POP, meets the main requirements set forth by the order of 1st of September 2016, 6821/1, on the order of awarding academic degrees at Petersburg University. And the applicant, Kubin Nikita Dmitrievich, deserves to be awarded academic degree of Doctor of Medical Sciences, specialty 140123, Urology. Clause 11 of the order has not been violated by the applicant. Thank you very much. Thank you. Dr. Gvozdev. Good morning, dear colleagues. I lived at the time. This problem was really challenging when all kinds of open surgeries were conducted for POPs and stress incontinence, SUI. But now that when contemporary methods became available, and I also tried these technologies, especially these methods are still, when I took a course in laparoscopy, where these methods are still used, and I think, this is really a very challenging problem. As you say in the introduction, almost every second woman encounters POP or SUI problems, so maybe this problem is even more serious. So these miserable women, these poor women, never seek medical assistance. They are ashamed to go to hospital, and they become socially isolated. Families, their children are ashamed of them. And as for relevance of the topic is very relevant, because this disease is very common, which I mentioned. The methods which I mentioned were not always efficient and traumatic. When implants arrived, mesh implants arrived, all surgeons started using them, not necessarily with insufficient indications. And I actually encountered cases where prosthetics were installed without good indication. So I had a feeling that this was a disaster. And when at various conferences the truth was revealed about complications, we found that the story is not that simple. The number of complications, efficiency, and well, the author who started dealing with complications and integration of new methods which allowed to increase efficiency of prolapse surgery and reduce the number of complications. So this study, the thesis, is very relevant. 4 patients issued. It's good evidence of that. After hysterectomy, prolapse, I think this is a very relevant clinical practice that maybe will be used in other hospitals. And as for incontinence, indeed, when they started using slings, first we thought the issue we have managed. We can now manage the problem of incontinence, but then it's very subjective. How this sling was, how could we employ a personalized approach? There was no universal approach on how to sling should be installed. This resulted in a low efficiency and many complications, and adjustable sling proposed by the author has dealt with these problems in a very efficient way, with the problems connected with complications and efficiency. And novelty of the work is really obvious, of the thesis. Again, is evidenced by several patents. And well, the thesis deserves the degree of Doctor of Medical Sciences, and well, the applicant deserves to be awarded. I had one question. In your thesis, you mentioned some serious complications which are very rare. You operated on many patients, and yet you mentioned complications. So could you explain to what these complications were connected? Did you have you classified these complications? Was it was damage to bladder? And you also mentioned, well, did you diagnose these complications, and how did you manage these complications? Yes, indeed, we had a number of complications. I will not hide that. I cannot hide that. And such as damage of bladder, bleeding, intestine damage. And well, what's important here is early diagnostics. All the complications that we encountered in our hospital, all the complications were diagnosed during surgery. And in case of intestine damage, we removed the sling, and well, intestine damage was repaired, and so we reimplanted the sling, and well, in the end, well, the patient achieved good results. In case of bladder damage, well, there was well, we followed the standard procedure, installed controlled bladder, and then we managed this patient following the standard procedure. Had no complications, no problems. Complications occur when we have little control of what we are doing, when we forget to control bladder, intestine, or in complicated cases where in the case neglected cases with severe where a patient was in a very neglected condition. And in conclusion, I'd like to say that the thesis of Nikita Kubin personalized approach to patients with stress incontinence and POP meets requirements set by the order number 6821/1 on the order of awarding academic degrees in St. Petersburg University. And the applicant, Kubin Nikita Dmitrievich, deserves to be awarded the degree of Doctor of Medical Sciences, specialty 140123, Urology. Clause 11 of the above-mentioned order has not been violated by the applicant. Thank you. Dear Chairman, dear members, in the past decades, there's been a big discussion between experts on using the use of synthetic materials for managing POPs and SUI. And on the one hand, we all understand that using slings was slings started a revolution. The method was very sparing previous methods as compared to previous methods, yet hyperactive behavior implantation of mesh implants produced great number of complications, and in some countries mesh implants were prohibited. And of course, naturally, professionals working in this field understand very well that in complicated cases of POPs, it's impossible to do without mesh implants. And a reasonable approach, which many experts in this field are sharing today, is that such surgeries should be performed in specialized centers, clinics, by experts with experience in this field. Secondly, that the methodology should include minimal use of mesh implants. And in my opinion, this approach is very reasonable, and the thesis is dedicated to this problem. As for SUI, the method is now almost became a standard, yet obstructive urination after surgery is remain a serious issue which is discussed in various conferences. And the issue of adjusting tension, they determine the effect of surgery, the result of surgery. That's why the subject of the thesis, the theme of the thesis, is very relevant. And well, as was mentioned already, standardized approach to managing patients and selection of the optimal treatment strategy very important, not only in our country but also abroad and in many countries of the world. We're talking of managing patients. I'm talking about chemical treatment. Well, the protocols are not always followed, so that's all human factor. That's why protocols that we really need for managing patients, such patients, are very relevant and valuable. Some words on novelty of the author suggested hybrid surgical reconstruction, pelvic reconstruction, created the first Russian apical sling, which today, in my opinion, is one of the best products available today. And this is very good to know. This is a high technology sphere, and well, it's a shame we get implants mostly from abroad. Here, high quality Russian implant was produced. A combination of advantages, facial technique, together the sacrospinal fixation. So all the combination of these approaches and the use of mesh implants is the reason why we had minimal number of complications after such surgeries. And if we talk about another field of research, it's a hybrid surgical method of POP management in patients with hysterectomy. The author developed a unique method which allows to apply combined, which is a comprehensive method. As for SUI, the applicant suggests a sling with early adjustment, with the possibility of early adjustment, which allows to determine the optimum tension at an early stage, and accuracy of obstructive urination is in such patients is very low after such surgeries. Also, I'd like to say that protocols for patient selection and sound protocol for patient management enable the author to achieve the minimum number of complications. It really jumps in the eye that the number of complications is really low. In general, this technique was used on many patients. But I've got a number of questions. Here are my questions. While performing surgeries, bladder was damaged in few cases. So I have a question. Was it necessary isn't it necessary to include in the protocol a guideline for actions in such cases, bladder damage, where there are no complications, and what prevented healing of bladder? Maybe you should review this recommendation. And I have another question about draining hematomas. Why did you use conservative approach in case of large hematomas of up to 500 milliliters? Today today we have evidence that active intervention can prevent serious complications, and the patient already is in hospital. About pain syndrome, you've already answered this question. So these are my two questions. About hematomas, which we had about 500, 800 milliliters. We monitored such patients. Drainage is not installed, and drainage system is not necessary because conservative therapy was sufficient, and the healing period was the same. Unlike standard hematomas, here we have two problems. Because we have an implant which is physically incontinent with hematoma, and a second peculiarity is that we use transvaginal access, and our experience with relatively large hematomas, they become naturally drainaged because such sutures on the front wall of vagina, and after 2 weeks, natural drainage starts. So we never had any problems in our patients. Average size hematomas are quite common in about 10% of patients. Large hematomas were relatively rare, so they get natural drainage was sufficient. And so we never had any, you never encountered any inflammations, any festering in one case. That happened because we used a large size implant. Well, the inflammation was fester was between implant and well, but these hematomas were quite small, 30 to 40 milliliters. And to be honest, we were not able to understand why this happened. This was some cause of response of the patient's immune system, or maybe some hidden sources of infection the patient had. And I have one more question. When using mesh implants, do you follow the protocol for patient preparation? Will you shave your patients? Do you use specific type of soap, etc.? To be honest, we shave our patients in hospital before. Every day we have 10-15 patients like that. Same same room, and the patients are treated before surgery. The field of surgery is treated before surgery, and we follow the standard procedure. We use standard chemicals. And are you satisfied with the answers? And let me read the closing remarks. The thesis of Nikita Kubin, personalized approach to managing patients with stress incontinence and POP, meets the requirements set forth by Order 6221/1 on the order awarding academic degrees at Pittsburgh University, and applicant Nikita Kubin deserves to be awarded the degree of Doctor of Medical Sciences, specialty 140123, Urology. Thank you. Thank you, Dr. Petrov. Dear guests, let me finish the procedure. And with my review, stress incontinence is a very relevant problem today, which should be looked at from two points. Like up to 30% of female population have suffer from stress urinary incontinence and pelvic organ prolapse. Second peculiarity of the there are many approaches, many methods which went through there were many changes when mesh implants arrived, video surgery, endovideo surgery, and yet there are still many issues with managing such patients, and even in if you look at the amount of discussion. Speaking of novelty, the author developed a new Russian implant, which is best evidence of novelty and the fact that the applicant obtained 4 patents. This also proves a novelty of the thesis, and it's necessary to see this thesis as new research. Practical value, yes, there is much practical value in the work because this results are can be easily and have been applied in many clinics. And clinical protocols developed by the applicant can be used in other hospitals as well, and there are many patients. Many patients have already been treated with these methods. The work consists of 389 pages of typewritten text, includes Russian and English versions, consists of an introduction, review of literature, of own research conclusions, practical recommendations, a list of literature which contains 245 sources. Research materials are illustrated in 14 tables and 60 figures. This is designed in accordance with the requirements of the Russian Federation and contains all the necessary sections. The introduction highlights the relevance of the topic, formulates the purpose and scope of the study, scientific novelty, and practical significance of the work. First chapter presents a review of literature. Second chapter, the description of materials, methods of research, the set of work, new synthetic implants for surgical reconstruction of pelvic. The third chapter presents the result of clinical application of hybrid surgical reconstruction of pelvic reconstruction. I think the word hybrid maybe because the applicant uses various methods, models in his and sling. So I would use the word combined instead of hybrid. Maybe hybrid is a fashionable word today. It's trendy today. Also, I'd like to especially like to compliment the thorough analysis of the complications. So they deserve special attention. So the applicant has been very open and honest. He says not only that his work is relevant and we achieved good results, but also describes problems that he has encountered and how he managed these problems. A fourth chapter is devoted to the development methods of prolapse treatment, and treatment results presented both anatomically and functionally. And chapter 5 describes the results of clinical application of slings with the early mobilization of prosthesis. He describes, gives practical recommendations. Which gives more value of the thesis. 6 chapters, the most interesting from a practical point of view, as it contains a clear clinical protocol of managing patients with POPs and SUI, criteria selected patients, describe post-operative and pre-operative periods. The conclusions correspond to the tasks set in the work and justified by actual data. In conclusion, I'd like to say that the thesis by Nikita Kubin, personalized approach to treatment of patients with urinary incontinence and POP, comply with the basic requirements established by the order of the 1st of September 2016, 6821/1, on the order of awarding academic degrees at St. Petersburg University, and the applicant Nikita Dmitrievich Kubin deserves to be awarded the degree of Doctor of Medical Sciences, specialty 140123, Urology. Clause 11 of the said order has not been violated by the applicant. Chairman of the Dissertation Council, Professor Popov. Further, let's give the floor to the applicant to give his comment, but you have already answered all questions. Do you have any further comments? No, thank you. I don't have any further comments. If does anyone here, would anyone here like to speak? Professor Shpenin, Professor of Department of Urology of Mechnikov Academy.
Нажмите кнопочку, пожалуйста.
dear chairman, dear council members, Dr. Kubin, dear guests, I could not help but speak. I am very pleased to be here when one doctoral student is presenting his thesis, where his academic advisor was your other doctoral student. I've known Dr. Kubin a long time. We have worked together a long time, and I know him well as someone who always wants perfection. I watched his research. I was very interested, watched his research with great interest, and I think this is a brilliant thesis, which is very relevant when implantation surgery arrived. Urologists immediately became interested in it. And since that time, new field such as urogynecology emerged, and as any teenage sphere or young sphere of science, surgeons wanted to try new techniques, and when new technologies arrived, this entire field, implant surgery, there's very often today we have a very heated discussion on should we use new methods or should we go back to the old methods, because so I've mastered surgical treatment, surgical protocol, so now I'm looking for patients who need it. So in that respect, the thesis is extremely relevant and important. And in the past decades, please correct me if I'm wrong, I don't remember, that Russia offered something valuable to the urology market. We've used products from Germany, from the US, and it's the first time since in a while since Russia suggested a quality product to the urological market, in this case, technology has already been implemented. 150 patients, if I'm not mistaken, has already been operated using this technique. And the fact that we have such an internationally recognized opinion leader with us today on the screen, the thesis is really brilliant. We really need it. And I'm not a member of the council, but if I were a member of the council, I would urge everybody to vote for awarding the degree. Maybe. So next, we will give the floor to the academic supervisor. Dear colleagues, dear friends, parents, families, relatives, there's no standard procedure for my speech, so I'll start by saying thank you to the guests who came to visit us.
Peter, что очень важно, наши.
What's very important, our foreign experts both visited our hospitals, and they saw surgeries that we have performed. They actually saw our work and appreciated what they saw. I'm very grateful to members of the council who agreed to participate to participate in the session, and chairman, all and members of the council, especially those who came from Moscow for this session. So the opinion of somebody who performs such surgeries every day and who started doing this many years before we started. And well, thank you to Professor Fedotov, because he created settings where we can make our dreams come true. We can do real research, and maybe that I'm being too optimistic here, but it's we very rarely have an opportunity to do real science where we don't have to think about numbers and indicators. Sometimes we have to reduce our indicators, and many thanks to the university who provided this opportunity. Preparing for this session, when I presented my thesis consisted of 250 pages, and a set of accompanying documents was 270 pages, so which makes preparation for the defense procedure so very challenging. So thank you, many thanks to the university, many thanks to our teachers. Evgeny Semyonovich, thank you. You were my first teacher when I took up urology. Thank you, Sergei Borisovich, because you got me involved in urology. And to all our teachers, to all our professors. So what's important in this thesis, because we are moving very fast compared to, in comparison with the procedure, this is not something was never changed. This is not a piece of work that will not change. Most of the methods, maybe except for adjustable sling, the methods described in this thesis became a basis for the development, current and future. So we're talking of hybrid reconstruction. In 99%, this technology is based on the results we obtained in the course of this study. It was a kind of it became a kind of a border, and research will, of course, I'm sure Dr. Kubin will continue his research. He will stay an active researcher. Thank you, everybody. That's all I wanted to say. Now, the most important point in our meeting has come. Please stop broadcasting, and I'm kindly asking anyone who is not a member of the Dissertation Council to leave the room, and you will be asked to come back when the discussion.
Это надо отдать? Или я могу забрать? Сейчас прошу.
Dear council members, dear colleagues, dear guests, let's do the voting. For me, this is my first experience, and for all members of the council, this format is new. And when I defended my thesis and my colleagues defended their thesis, we did not have open voting before, which was not necessarily a nice thing. Sometimes everyone gave positive opinions, and then suddenly the decision was negative, and the council members were not satisfied. So the new format, where the voting, we have to vote openly, allows us to eliminate such possibility. So let's resume our meeting. Please resume broadcasting. Yes, broadcasting is on. So the most important stage of our session has come. I now put the awarding of the academic degree to the open individual voting. Let me remind you that the decision of the Dissertation Council shall be considered positive if more than a half, but not less than 3 members of the Council taking part in the meeting voted for it in accordance with Article 23 of the procedure for the awarding academic degrees at St. Petersburg University. Annex number 1 to the order. Council member Gvozdev Mikhail Yurievich, your opinion? Have a positive. My opinion is positive. I don't have any significant comments. And my opinion is that Dr. Kubin deserves the degree of Doctor of Medical Sciences, and it's an honor for me to congratulate you. Dr. Guliev, I think that Dr. Kubin deserves to be awarded the degree, Doctor of Medical Science, Urology. Council member Dr. Petrov, I'm for awarding the degree, thank you. Dr. Zivert.
He will continue his work in the future.
Thank you.
Dr. Petros Peter Papa.
Yes. My answer is yes. The degree must be awarded. Thank you.
And my opinion as a chairman, I also have a positive opinion, and I think that the applicant also deserves to be awarded a degree. Let me count and announce the results. All members of the council voted for, no one voted against. Thus, dear guests and dear colleagues, that is out of 6 members of the council, 6 voted for, no one voted against, and no one abstained. The decision to award the degree of Doctor of Medical Sciences in specialty 140123 Urology to Nikita Dmitrievich Kubin was made. Let's give the floor to the applicant for his final speech. Dear members of the council, thank you for the opportunity. Thank you for finding time and for positive evaluation of my work. Thank you. Many thanks to my academic advisors, to Dmitrievich Karupa, director of my hospital, Dr. Fedotov, who allowed me to conduct this study and to develop, to gain experience. Thank you to all the speakers, to my first academic advisor, with whom I started my career as a researcher. I hope we will stay in touch. Thank you. Many thanks to my family who supported me as a person and as a scientist, and I hope they will continue supporting me in my research. Thank you to all the attendees for your support. Of course, this would never happen without the effort of many people working in our clinic, who helped me not only during surgeries and who gave me valuable advice. And this thesis is an outcome of effort of many authors with whom we will continue working together, hopefully. Thank you. The session is closed. Thank you, everybody, for your time.